Thank you for tuning in, guys. Welcome back to another episode of our estate planning podcast. Today we're chatting with the lovely Wendy Tang. She's here with Modern Angels, and we're so excited to have you. Thank you for coming.
No problem. I'm happy to see you both.
So can you please introduce yourself and tell us a bit what your company does?
Sure. So my company is Modern Angels. Modern Angels is a private healthcare provider, and we provide PSW, RPN, RN, and companionship in Ontario.
Nice. So what kind of clients do you deal with?
We usually deal with clients from all walks of life. So when people hear about private care providers, they usually think seniors or older adults. That is not true. We have clients that may have suffered an injury, like after a motor vehicle accident, or clients that are post-surgical coming out of the hospital. The client could be a child or a mother or someone that just went through a chronic illness and are currently getting discharged. So all walks of life.
So where Wendy and I connect is we're both nurses, so go team nurses. And I actually do have experience in long-term care, so it's kind of different from what you do. And
Because she sends the team to the clients' homes.
Yeah,
Yes.
okay. I used to do that as well when I was a student, but the one thing that people forget is that it's not just the senior population who needs these services. When I worked in long-term care, I remember I was shocked that the youngest client there was 17. So,
Wow.
yeah.
For long-term care?
Yeah,
Really?
but I think it was more of like a genetic thing that this person was dealing with.
Yes.
I never met this client, but it was just somebody who had, congenital differences. I'm not sure how to
Wow.
say that, but anyone needs it, so...
For sure. And for my nursing background, so I never actually finished my full degree. Funny enough, I had a stroke at a very, very young age and I was hospitalized. But that's where my passion grew for private health. So without finishing the degree, I moved into nursing education instead. So less practical, more theory based. And that really similar experience, I saw people from all walks of life being a part of a team that really got to see, case scenarios as real scenarios and being able to help assist that way to develop more educational purposes and pathways.
So how old were you when you had your stroke?
Oh, I was only 20.
20?
Yes.
Yeah. I do remember you've told us the story before. It's
Yes.
crazy. Because it just reminds you that any age, any situation, anything can happen.
Yes.
So it does actually make you the perfect candidate for Modern Angels.
It does.
The perfect
And
person to help.
yeah.
I'm so glad that you recovered from that, and thanks for sharing that with us.
Yeah.
Not to speak of Amber's experiences, but she also had a surgery before. So I could imagine the point where she was recovering at home. Your services would have been ideal for her had I known about them at the time, because I was the one.
She was mad scrubbing my hair for me.
Yeah.
She even
Really?
did wound care for me, actually.
Oh my
I guess that's
goodness.
probably inappropriate now that we're old enough to reflect. But,
Wow, that's amazing.
She helped me change my bandages, and she was not okay with the task.
Yeah, but
Wow.
that's why we really wanted to show our viewers what options there are, because not everybody knows of these types of services. Like you said, somebody can be discharged from hospital and then they think with their families, they think it's now up to them to do the aftercare, but it's just great that
Even companionship.
Yeah.
So it's literally every age you hit. So you guys will do the post-op care, do you? What does that look like?
Yes, we definitely do. So usually when we encounter a client or their family, they've kind of reached a point, a critical point or a crisis point where something has happened and it's really affected their mobility, their emotional health, or their capacity, whether it's themselves or the POA, the power of person holding the power of attorney.
Yeah.
And so from that point, it is our job at Modern Angel and the job of our case managers to get in touch with the client once they reached out. Yeah. And through the process of consultation, which is completely free, the initial consultation by RN, we're able to assess and be able to evaluate and learn a bit more about the family, the client or the patient and their needs.
Yeah.
So you also mentioned companionship. What does that look like?
Yes, and I'm really grateful that everyone sitting here today has had their own experiences, whether as clients, patients, or as the caregiver, unwilling or not.
Yeah, by force.
Wish I knew about you guys then.
Yes, absolutely. So that experience just teaches you that it's hard for family to say no. And it's hard for us to be able to draw boundaries to protect our own individual well-being while caring for others. So what do we do in those situations? There's a couple options, such as respite and as well as companionship. In situations where it's not medically as dire, or even for someone that has, let's say, cognitive decline, such as a dementia patient, they may require just companionship, or if you're lonely, or if your mental health is not doing well. There's also cases where, you could just want someone nearby, right? I think during COVID, there was a nurse that developed the hand. They put warm water in the gloves so that you could hold their hand.
Oh,
and that's
like
really
a companionship for dementia people?
Well, that method really worked because people were isolated. They were lonely. So it doesn't have to just be limited. It could be for anybody and any ages, really.
Yeah.
Right? So I think it sometimes can be, we have that mindset of ageism, that private healthcare or services like companionship and respite is just for older adults.
Yeah.
Yeah.
I guess for a lot of our clients, it's some immigrant population, all their families back home. They may not have ever had children. So it's just people who don't have that immediate circle that don't necessarily know where to reach out to.
Yes, and people don't think about social isolation in that capacity. So being sick by yourself, if you were injured, even working 30, 40s, I don't have any family in the city. If you got sick, if you had something in your eye, an injury, what are you going to do? Are you going to call Uber and have the driver come pick you up from the couch?
Yeah.
Right? So
and you did even mention sometimes you have mothers have care after they have their children.
They can absolutely reach out to us. And of course, case by case is really about understanding what the client's needs are, what the family's needs are. Yep. So for us to be able to provide the type of care or the type of service that really embodies compassion, precision, and as well as dignity, we have to truly understand who the person is. What would they like as an outcome? Yep. It's listening to the patient or the client. And sometimes that gets lost.
So I do want to bring this back to seniors because we do have a lot of clients who tell us that their wish is to stay in their home for as long as possible. So I just wanted to know, what benefits do you see for clients who stay at home but may need your services as opposed to going into long-term care facility?
Absolutely. So there's a lot of benefits. I think there's an option for everyone, but for Modern Angels, because we're a private care provider, we try to look at outcomes more precisely. So that means that we're looking at what the family wants and the individual's needs are to a one-to-one. So usually when they're aging in place, we're providing one-to-one customized care within their comfort zone, their home. So in most cases that we see, clients, they might want to stay mobile. They want to have hobbies. They want someone to be able to cook for them and be able to do at least housekeeping. Maybe it's about, remaining independent from their children without restrictions. A lot of times when we say long-term care, I think even for me, the fear is I'm going to jail, right? I'm not getting out.
Yeah.
Right? So it's the fear of losing your freedom. It's the fear of losing your choice.
And you did say comfort. Yes, everyone feels comfortable in their homes that they've lived in for however long. So it's a good point. Yeah.
When I was a student and I was working as a in-home PSW, I found I really quickly became part of their family. And
Yeah.
it was cute for, I guess, my favorite client. On my last day, I framed a selfie of me and her and I gave it to her, and she was so funny. Me and her had a great time. She used to make me boil salmon for her, and I would tell her, that's disgusting. She's like, what? It's so good. You got to try it.
No,
She was so
I
funny
love
'cause
that.
We were just crossing like the cultures, the generations. We were getting to know each other. She actually grew up 2 doors down from where I was living at the time, so we were just having a great time, the two of us. And I remember once I made her salmon skin by frying it. She told me, don't you ever give me that again.
Yeah.
It's just such a different experience because you truly just become part of their family.
Yes.
And yeah, I was placed with her. I was scheduled weekly with her. How do you guys approach pairing the clients and the caregiver?
I think this really is the entire wraparound around this question and the previous question about aging in place. So when we meet with families about aging in place and having that option, usually we're coming in at a time where they are looking for answers about whether or not to sell their home, leaving everything they know behind. So for us, the way Modern Angels has been run by our founder, Girlie, she's coming from 28 years as Sunnybrook, as a nurse, a case manager, and as well as an educator. So our thinking and our model and our ethos has always been wrapped around compassion and person-centered and really listening, understanding, and delivering. So with families, we try to understand who they are, what they want, what makes them comfortable, what is care to them. So oftentimes in workshops, I'll ask that question, whether it's nurses or executives or yourselves. I always ask, what does care mean to you?
Yeah.
And I think Girlie asks that all the time. I really love it. And somebody will say something different.
Yeah, it's
Like,
such a basic
right?
question, but it's like so thought-provoking.
Right?
So
What does it
everything
mean
depends
to you?
on
Right?
everyone's individual needs.
And that's the problem with these questions, is it depends.
Yeah.
Yes.
There's no answer.
Yes.
Right.
So we have amazing care companies all over Canada and Ontario. Why choose Modern Angels? We can say we care, and we do care, absolutely. We care what care means to you. So that's what makes the difference. So we listen, and they can say, well, I like golfing. I like this. Well, my mom enjoys cooking. She wants to maintain that. It's not about fast. It's not about quick turnaround. It's not about temporary. It's about long-lasting effects of what you want at the end of the day. So when we select our PSW and nurses and other employees, we look at them as family too, because we need to understand their personality, their wants and needs. So it's kind of like a little balance and dance of matchmaking.
Yeah.
Right? And to think about that is, I'm not going to pair someone that is a chatterbox, enjoys lighting up the room, Amber, with someone that's seeking peace and quiet.
Yeah,
right?
You know how many houses I would go to and they would be like, you better not talk to me. The last girl, she would not stop talking. She would just sit there, never vacuum. I was like, what would you like me to do?
Yeah. And it's about your enjoyment as
Yeah.
well as the comfort of our staff.
Yeah.
And they really shine, right? Both ways. So pairing, it's like matching friendships.
Yeah.
And looking at it that way, then it's no longer a job. And when you're having fun, the client, the family is enjoying themselves. We've seen cases in families we work with that have left us reviews, given us permission to film, actually. I could share some of that with you. And they are elated, and they've been with us for a very long time with our caregivers who really do bring a smile to their face.
Yeah.
And they will compliment them. They'll say, well, we went out and did this. You know, they bought me this puzzle book, or they were dancing in the living room together, right? Laughing, and she hasn't danced in years. So it's those small moments that are fleeting and incredibly rewarding for our staff and for our team members.
So what's your favorite part of what you do?
My favorite part, honestly, it's hearing from someone that a difference was made. So I don't think it really hit me until about 2 months ago when someone came up to me at a meeting, at a business meeting that I've never met before. And they said, Modern Angels. And I was like, yep, that's me. And I was like, what's going on here? And this man was like very serious about it. And I was like, okay. And he's like, my family, we actually had a PSW from you. And I was like, oh, okay, excellent. I was like, I was like, I didn't personally know, but, and he said, what a difference. And I found out our staff and as well as our other team members even attended the funeral once his loved one passed. And it was just incredible. And the family.
Just the extension of family. That's what's nice about this job.
Right. And it just like, it's a sense of pride, and it's also the sense of knowing that we made somebody's last moments better.
Yeah.
And right. And it's rewarding that way. And we might not hear it from everyone, but hearing it once is more than enough to know that it exists.
Yeah,
right?
I confess this is a terrible question for a nurse because there's just so much.
Right?
It's actually, you become part of the family. You become very important to them. And then you catch yourself thinking about these people when you're at home and when you're off the clock. And it's nice because it's true caring.
Of course. I can see your like eyes well up when you talk.
Because I'm just thinking of when I was a PSW, it was so funny. Like the amount of different clients I would see, the ones that I really connected with, and like how you do truly make a difference just by, sometimes it's sitting there. I just sit there and watch TV with them. I'd put a TV dinner in the oven. And I was like, do you want me to cook something? Like, no. I've ate this for 60 years. I'm like, okay.
Wow.
Like they don't want to change their routine. They just want you to come and meet them where they're at. And sometimes they do just like to yell at you at first because you got to establish that relationship.
Yeah.
Okay, I'll stop talking, but
no, but that's great. And it's and that's what comes with having a great team and really embodying, being a true healthcare provider and being proud of that. And you embody it. And I think our team at Modern Angels really embody that. And they really do show up. And I think it's easy to show up to a 9 to 5. I think it's very difficult to show up every single day when you know that person's well-being is dependent on you, and to smile through anything and being able to walk them through to the end of life. And I think that's incredible what they do. Yeah.
We do too.
My clients used to hate me though because I was studying nursing at the time, so I could see some medical things going on with them. I remember once me and her got on, we loved each other, the salmon lady. She was having a headache, she was struggling breathing. She just got out of the hospital. I was like, girl, you don't look so good. She's like, I'm fine. I don't want to go. I said, okay. So I had a 2-hour break. I went home and I returned. And she's like, oh, Amber, I've got such a bad headache. I was like, I'm calling an ambulance. And she had pneumonia. And then she ended up staying in hospital for another week. She came back and she was like, oh, thank you so much for sending me. I was like, what's that on your leg? She's like, it's nothing. It was shingles. I was like, lady.
Oh my
There's that extension piece of caring. Like you're just always looking out for them, always looking at what's changing and how can we like fix them, I say respectfully.
Yeah, and that's like going the extra mile, right? And that's what it's all about. And it's really from top down. And the reason why I chose Modern Angels to work for is especially because of leadership. So, and don't worry, I know she might be watching this. I'm doing this of my own volition. I'm not being forced to, but she really embodies that. Girly, she really does.
She's lovely.
She does. And there's been moments where I've literally said, at some point I will start a charity for you, and then you can do whatever you want. But until then, we cannot do this, because she goes out of her way for everyone, and she's utilizing her own time. Sometimes, like 7 days a week till the middle of the night, she's gone out of her way for clients, and it's absolutely incredible. And she's always been the one that people reach out to, because she'll respond. She cares, whether it's employees, whether it's a family member. She's the first call that they want to make, and I think that speaks for itself.
Yeah.
Right?
Yeah, it's lovely.
Yeah.
We're so glad we met you guys.
Yeah.
Me
so
too.
just can you please share with our viewers, how can they connect with you if they want to learn more or start the conversation with you?
Absolutely. So the best way I would say would be go on our website, which is modernangels with an S .ca. And as well, we have all of our information listed on Google, so you can search for that too. And I'm sure attached to this video will be a direct link or a phone number. And we would be happy to hear from them. And it's never too early to start planning. And I think what's really important, and thank you for inviting me, because I think I strongly recommend to think about the future at any ages, to think about who will be the power of attorney should anything happen. We see it all the time, 20s, 30s, 40s, 50s. You can't prevent that. And for us, medically speaking, or healthcare, how do we know when people need help, or maybe they require the step to call you as well, is their emotions have changed, their routines have changed, their habits have changed. They are no longer themselves, and they are struggling quite a bit. And I think as family, as friends, anybody can advocate for that. To call Halo Law or to call Modern Angels, we're happy to work together. And I think having a team on your side earlier and knowing that it's there makes a world of difference.
It's true. It's the building the relationships and it just makes it nice and smooth. So the time was yesterday, and it's easy to call.
Yes, absolutely.
So that's just it. We want to make sure people know that there are options and know how to reach you if they need to. So
no, that's fantastic.
Thank you
we would
so
love to
much.
hear. Yeah.
Thank you so much, Wendy, and we appreciate all the insight you gave. And anyone who wants to get in touch with Modern Angels, please do.
Yes.